As you can tell from my accent, I'm originally from Ireland. I first started having back problems in 2002. One night I was driving home and I lost the power in my right leg. And I had a series of 6 back operations between 2002 and 2018. I was continually kind of falling all over the place. I formed a very, very intimate relationship with most of the flower beds in Arlington because I would just, my legs would give out from under me and I would fall into a flower bed or a garden or something like that. So I was very, very concerned about that, and I thought, oh my God, am I ever going to be able to walk properly again?
So when Mark came to see us, he had already had a neck surgery and a lower back surgery many, many years ago. He initially did very well, but he eventually developed complications from the surgeries with degenerative disease above the level of the surgery in his lower back.
Even though I had these 6 surgeries prior to meeting Dr. Fanous, I thought they would just repair L4 and L5 again. That was my expectation. And it was Dr. Fanous that said, no, if we're going to do this, we're going to do it comprehensively.
So we looked at different technologies for Mark's surgery, and I chose the augmented reality X-Vision system because it allowed us to do minimally invasive surgery for him. Not only that, but also allowed us to look at his spine and be able to do decompression, which is what he needed, in a minimally invasive way. So the augmented reality technology allows us to be able to visualize the person's spine without actually doing any surgery and without cutting into the patient. So with our naked eyes, we would be seeing the skin of the patient, but with the augmented reality system, we'd be able to see and visualize with very, very high degree of accuracy the patient's spine. This allows us to be able to target exactly the area of the spine that needs to have the surgery done, and this allows us to perform the surgery in a minimally invasive way without doing very large incision or a lot of muscle dissection. And for the patient, of course, that translates into minimal pain after surgery and very quick recovery and minimal time in the hospital. The surgery involved decompressing his nerves above the level of his first surgery and then connecting the new instrumentation to the old instrumentation he already had in his lower back. The surgery went extremely well. He was in the hospital for only a few days after surgery.
Dr. Fanous told me that, complete recovery would take about a year. So that was very good for me because, I'm the sort of person that wants to recover in 2 weeks. I feel that my back is stronger. I feel that the pain I'm suffering at the moment is minimal compared to what I suffered in the past. And I'm very, very hopeful for the future. I want to go back to Ireland next April. And so I have that trip basically planned. Oh, my new goal is to be able to run 3 miles again, which I used to do.
It makes us at Innova very, very proud, and it's what we want to do for our patients, and that's why we're here, to provide our patients with the best technology and the best surgery ever to help them get back to their normal routine and their normal self.